internship program that we have within the North Cumbria Insights program. So that's hopefully what you're doing here. Next slide, please. So yeah, it's going to be recorded. You've probably seen the little red button at the top already that's on, and that will be made available on our website. Please keep your microphone off or muted, during the presentation. And again, if you don't want to be seen, make sure you keep your cameras off. And yeah, we've got the chat at the top of the screen for you if you want to put questions in, or please, because it's just a small group, feel free to raise your hand, and we'll answer anything you've got to ask about. Next slide, please. Okay. So over the course of probably won't be an hour, you'll be pleased to hear, but over the course of the next little bit of time, we'll have a look at why NIHR and why this experience, who's eligible to take part in this, how long is it over, and we've also got a video of somebody who's already been on an internship program with us, just to give you their experience really about what it was really like to do an internship with Insights, and that's hopefully what you got this afternoon. Hopefully you'll have all heard about the NIHR, and that's really the research arm of the NHS. And now the NIHR have lots of funding available to support people like yourselves to develop in their careers in research, whether that's a clinical academic career or working in research delivery. And what they recognised a few years ago was there was a kind of a bit of an area of support or a bit of an area gap for people who were either during their development time and their undergraduate courses and early postgraduate courses. So they wanted to kind of change that. So they've kind of given a bit more funding over the last couple of years to try and expand the provision of training for people much earlier on in their careers than they had done before. So that's how this Insight funding came about basically a few years ago. Next slide, please, Emma. So these are all the opportunities that NI have to offer, and you can see there from the very initial experience with internships and insights programs, that's where we sit. You've also got pre-doctoral awards, and that's going on to doing like a other kind of training, but it does include masters as well. They also do fully funded masters, PhD opportunities, and also postdoc opportunities as well up to a professorial research chair position. And they've also got bridging and short-term funding opportunities, and they've also got what we call infrastructures within NIHR, and that's you can see down the bottom there, that's like the ARCs, the Applied Research Collaborations, the Biomedical Research Centres, patient safety research collaborations. So there's a whole range really of NIHR infrastructures where they've got grants, awards and opportunities. But for us, for Insights, we're very much that initial experience, kind of dipping your toe into the water, what research is all about. And that's where we're going to talk about this afternoon, of that funding opportunity that we've got available for internships. Next slide, please, Emma. So we're one of 12 programs. So anywhere that you live within England, you can be linked to a NIHR Insight program, and that's very much linking in with the infrastructures that we've got within England and where the research delivery networks are. And I said this was part of this £30 million investment to try and expand this portfolio for training and development for all health and care staff, really. And Insights is available currently to anybody other than doctors or dentists. And it's about showcasing and attracting people into it, and then really embedding a positive and inclusive research culture within health and care research. Next slide, please, Emma. So Insights Northeast, North Cumbria, you can see we cover a huge geographical area. So we're all the way up to Berwick, down to Middlesbrough, and then across to North Cumbria. So a large, geographical patch that we cover. I said I'm attached to Northumbria University, but we've also got partners with Newcastle, Teesside University, University of Sunderland, and University of Cumbria. So anybody working or living in that area, if it's a criteria, is eligible for our programs. As I said, because there are 12 Insight programs across the country. Yeah, obviously, if you live somewhere else, you'd be able to apply to their, your local Insight program. Next slide, please, Emma. And really, this was kind of what came up with our original aim. This is coming into our third year now, just next month for Insights, but it was really trying to get people engaged, as I said much earlier on. As I said, I'm a clinical academic and have been for a number of years now, and I know often in the past people have had difficulty with trying to develop as a clinical academic or trying to get into research, and often it was only after you've been in practice a number of years before you could get access to research training or development. And that meant there was a huge gap between finishing your undergraduate program and then actually getting into research. So we wanted to attract people much earlier on, and that's what this is all about. There's a whole diverse professions across the area. So I said this is, looking at nurses, midwives, physios, paramedics, healthcare scientists. We've got radiographers, all sorts of professions are involved within this. And across the Northeast region, we've got 1,600 undergraduate students with over 50 programs in health and social care. So you can see that this is available to lots of kind of different individuals across the region. And within this offer, we've got some fully funded research internships across any of the 5 universities that we support. And this is what we'll talk about a bit more this afternoon about what this offer entails. Next slide, please, Emma. So it's to support students who are in health or care professions to develop their understanding and skills in research that can be applied in ways that can improve the lives of people across our region. And it's really kind of be very much tailored to the individual. So depending on where you are, what you want to do, what you want to look at, you'll very much be in charge of what that opportunity will be, with some kind of like additional built-in support and framework and infrastructures around that with mentorship and guidance. On the slides that you'll all get, you'll also again see the link, if you haven't seen it already, to how you apply for that internship opportunity here. Next slide, please, Emma. Okay. So who's eligible? So I said this is for students. So hopefully you'll be in your 2nd or 3rd year or for your final year, because some people I know will do a 4 years masters within the programs. As long as you're kind of like coming up to the final stages really of your undergraduate training, you're eligible to apply. And this is for term time. So we did hold a webinar a few weeks ago looking at vacation internships. That's doing an internship when you're on, it's usually the summer vacation, but this is intended for term time. Okay, so as long as you're working within the Northeast North Cumbria area, you're kind of coming up to the final years of your undergraduate course or degree, then you'd be eligible to apply for this. And as long as I said, on the right hand side there, you'll see the training towards one of the following professional regulatory bodies. So that could be Academy for Healthcare Science, it could be Dental Council, it could be Optical Council, it could be the NMC or the HCPC, or working towards the UK Public Health Register. So as long as you are working towards one of those regulatory bodies that you'll eventually become your regulatory body, then you're eligible to apply for this internship award. Next slide, please, Emma. And again, it could be a whole range of professions that you might be training towards. And this is just a list of some of those. So you can see it's very broad reaching opportunity that we have here today. Next slide, please, Emma. So it depends on, we're not specifying that you have to undertake your internship in your area of HEI. So it could be the fact that you are, down in Middlesbrough, but actually you want to spend some time with some researchers up in Newcastle, or the fact that you're up in Newcastle and you want to spend some time with some researchers down in Middlesbrough. We can do this connection. So it really doesn't matter. It's about kind of like having an opportunity to, have some time across any part of the region really, and linking into any of those research teams that's available to you within the Insights program as we're all linked in together. Next slide, please. And for the term time research internship, next slide, please, Emma. Okay, so what's expected from you? We would hope that you'd attend some support meetings and you need to engage with your mentor. And this is just to make sure you get the most out of the opportunity really for the internship. And hopefully you'll also act as a role model and champion research within your area to show others that this is an interesting and a great opportunity to take part in. You need to develop a plan for your next steps as well. So whether that's formal education or exploring opportunities for potential onward fellowships or funding, or interesting clinical research delivery, be really helpful to understand, because it's about having done an internship, what are you going to do next? Usually it's a bit of a pathway with research. It's really, there's lots of opportunities, next steps. So you might want to think about, okay, then having done this, if you dip your toe in the water, you might think about what else you might want to do. And certainly we had a number of interns who've been already involved with Insights who have now gone on to do their masters in research. And that's often a natural progression, that there you go on to do a bit more training and a bit more development around research skills and knowledge framework. What we would expect, though, all interns who take part of the Insight program is to prepare a poster and hopefully present your work. We have a celebration event once a year that we bring everybody together to talk about what they've been up to, what they've been doing, what they got out of their internship program. We had this a couple of months ago, and this was a fantastic evening, really, of celebrating what people were up to. And it was just fantastic to hear the projects that people had been involved with and what they were doing, some intercollaboration working, and just that people have, had done some great stuff, including, getting publications out of this. So yeah, we would expect you to be, also up, developing a poster as part of your evaluation of your internship. And as this is an NIHR funded opportunity, again, we have to report this back to NIHR as a funder to let them know what you guys have been up to. So there's also an application evaluation form that you'll be required to fill out. So there's a lot of support there. So Emma on the call, who you've already met, Emma's been fantastic about supporting interns with developing posters. We get those posters printed for you. It's a really great thing for your CV to go on to, and it really helps to kind of like showcase your work really. So think of it as a supportive thing rather than as a thing that could be a bit scary or unusual. Okay, next slide, please, Emma. So these are the catch-up dates. Emma, do you want to quickly talk through these?
Yeah, so we basically tried getting all the interns together before we had our internship meetup this year, and it worked really well. And it turned out that a lot of people were interested in meeting one another and chatting and also getting some support. And so what we're trialing this time around is having some periodical catch-ups in the diary where all the interns get to meet up with us. I will always be there, Annette will be there when she's around. These are the dates that I've sort of ring-fenced in the diary for this. If it turns out that they don't work for anybody but me, we can definitely change them. There's flexibility to it, but I think it's helpful to sort of just outline them so that people can hold them in their diaries if possible. The idea is that you get to meet the intern cohort, you get to exchange what your experiences have been, how you've been doing. People might have advice for each other. I'm also really interested in how we can support you. So, for example, presentation skills or making a poster or any other research skills that we could give you a hand with. We'd be really interested to hear that and see how we can facilitate that. And the sort of idea behind this scheduling is that our last meeting should be on the 24th of February because we're aiming to have our intern celebration event sometime in March 2027. So hopefully we'd have the February event to sort of wrap things up, make sure you've got the support you need to present your work at that event.
Brilliant. Thanks, Emma. Great. And this was just a couple of pictures really from our celebration event this year, which was fab. And I see that Barry's joined us on the call. Barry, do you want to just introduce yourself quickly? And if you want to say something about the celebration event too, that'd be fab.
Yeah, thank you, Annette. Hi, everybody. Lovely to meet you all. My name's Professor Barry Hill. I work at Northumbria University and I support the team. The celebration event was really, really fun. It brought together lots of different kind of interns from lots of different programs across nursing, midwifery and kind of AHP teams and some of the medical students. They came together, we had a great time. We was on campus. And it was a really good event to get together. There were some poster presentations. They were scored and there were some awards and some certificates giving out. So that was really good fun. And then all of the candidates had an opportunity to stand up and present their projects. I know Ryan's on the line as well, but all the projects could have, be shared with everybody else. A whole different array of different things around internship. So a really good opportunity. It's paid. It's good work, it's good for the CV, it's really good for careers as well. And it does kind of give you more insight, into the research and clinical academic careers. So really good fun. Lovely to meet you all.
Thanks, Barry. Yeah, it was great event. So just something really nice to add and a nice end to your bits. Just to say this time round, we've also had Dr. James Faraday come forward. So James is a speech and language therapist. He's a clinical academic that I work with, and he's got some funding to do a project looking at better meal times for people living with dementia. So James is offering, if anybody doesn't have an idea to do an internship, they could actually work with James for the period of their internship. James is based primarily at Newcastle hospitals. And again, if you're interested in that kind of opportunity, then please contact James directly. But what we're trying to do over the next, few years, hopefully with the internship programs, to offer other opportunities as well. We're looking in with other research teams because sometimes you're not quite sure, what's out there, what opportunities are available, and actually having that connections into practice. This time around we've got James's offer that's available to everybody currently. Thanks, Emma. And certainly, you know, if these are the leads that we've got for each of the HEIs. So depending on where you are, please get in touch with either Barry or Lindsay or Jeff or Catherine or Tom, you know, who can always, again, talk through the practicalities of doing an internship within your own HEI, what that might look like, what support there is available for you at your university where you're studying currently. And also just to kind of get some other practical hints and tips or advice or support, and they can certainly guide you and direct you to kind of different mentors or different supervisors. I'm really there to help the whole process. And again, if there's any issues or concerns through the internship, then please just get in touch again with your leads, who are more than happy to support in any way, shape they can. So Emma, I believe we've got a video, have we?
Yes, that's right. So we have a from one of our interns who actually completed the vacation internship, but the format is the same. There we go. And has then gone on to do a master's with us and is now applying for PhDs. So she's a perfect example of how an internship can kickstart that pathway into research. Now let me try and share this, and please let me know if you can't hear the video.
Good afternoon. My name is Roisin El-Fatahi and I am a registered mental health nurse. I qualified back in September 2025 at Teesside University, and I'm currently enrolled on the Masters in Clinical Research degree. Again, I'm at Teesside, and that's where I'm at the moment. I'm actually in a lecture on data management in clinical research, so I'm sorry that I can't be with you today. I'm here to talk to you about the vacation internship that I completed last summer. August, September time I completed it. It was over 3 weeks and I completed around 65 hours during that time. My initial interest in research started at the end of first year of my nursing degree, and I've been discussing research with my personal tutor, Dr. Mark Seward, during that time, and we both had an interest in military and veterans research. And it was during the application for the NIHR funding for my Masters, I decided early on that I wanted to do a Masters in Clinical Research. And when I was doing the funding for the NIHR, it was brought to my attention that there was the potential for me to do a 3-week internship over the summer. So Mark and one of the principal lecturers had a conversation and they agreed that I could do it as I was up to date with all of my placement hours and my assignments. So the aim of the research that we completed, and we're still working on at the moment, is NHS staff's awareness of veterans' mental health in the Tees Valley. We looked at research methods and designs. We decided on a qualitative approach to the study. So we were going to conduct one-to-one interviews in the future. And I helped with creating the research questions for the interviews. I designed a research recruitment poster, which I really enjoyed. I like that creative side of it. I also worked on the participant information sheet and the consent form. One of the more challenging parts of it was the ethics application, but that has been so valuable to me because I'm just about to do my own ethics application for my master's dissertation. So it's come in so useful that I went through that process. Everything that I did during the 3 weeks has come in useful for my master's. I'm using everything that I learned, everything, probably on a daily basis, and I know that I'm going to continue to use it in the future. I'm continuing to work on veterans research for my master's, and I hope to do a PhD next, and there's a good chance that that's going to be to do with the military and veterans too. The internship was an amazing experience. It was an amazing opportunity, and I would recommend it to anyone even remotely interested in any type of research. It's really beneficial. I can't emphasize that enough. I really can't. So that's it from me. I wish you all the best of luck, especially to those that are applying for the internships this year, and I hope you enjoy it half as much as I did. Thank you.
Lovely.